Start.
So I'm in the nursing station, and I'm going to begin by comparing my physician's order with my MAR. So in doing that, I'm checking the patient's name, Jasmine Green, the type of medication, furosemide, the dose of the medication, 20 milligrams, the time of the medication, every 8 hours, and the route, I'll be pushed. Then I'm going to assess for allergies. The patient has none known allergies. So and then I'm going to go to before I do that, I'm going to compare my medication with my MAR. So we have furosemide, so it matches. Now then I'm ready to go to my book. So when I'm in the book, I'm checking to make sure it's a safe dose first. So the book states if it's used for edema, it should be 20 to 40 milligrams, and it may be repeated in 2 hours if necessary. Increase the dosage by 20 milligram increments under close medical supervision and no sooner than 2 hours after previous dose until the diuresis is obtained. So it's a safe dose. Dilution, it may be given undiluted. Compatibility, so we have normal saline hanging. So it is compatible with what's hanging. The rate of administration, IV injection, and the book states each 40 milligrams or fraction thereof should be given over 1 to 2 minutes, and we're given over 2 minutes. Precautions, so the book states to use caution and the book states to use caution and improve basic condition first in hepatic coma, electrolyte depletion, and advanced cirrhosis of the liver, supplemental potassium chloride, and if required, and aldosterone antagonists like spironolactone are helpful in preventing hypokalemia and metabolic acidosis. Excessive diuresis may cause dehydration and blood volume reduction with circulatory collapse and possibly vascular thrombosis and embolism, particularly in the elderly. This medication could cause ototoxicity, so the patient would have tinnitus, reversible or irreversible hearing impairment, and deafness that have been reported. And monitor, we need to make sure we monitor the blood pressure frequently, especially during initial therapy, because it can cause orthostatic hypotension. Okay. So, still in the nursing station. So, I'll work my drug problem, and we're going to be giving 2 milliliters over 2 minutes, so it'll be 1 milliliter per minute. And then I'm going to wash my hands and get my equipment together. I'm gonna clean it for 30 seconds and then let it dry for 30 seconds. Okay. So we're giving 2 milliliters. I got a little bit of, okay. So we're giving 2 milliliters. Okay. 2 milliliters. Right. And I already filled out my label. I labeled my medication. So I pulled up my medication. Now at this point, I'm ready to go to the patient's room. So I go to the patient's room, I introduce myself, Akia Coleman, I'm your student nurse. And then I use 2 patient identifiers, patient's name, date of birth, and they state that. Then I explain the procedure to the patient, tell them that the doctor has ordered for them to get an IV push or furosemide to maybe help with edema. And teach the patient that this medication will cause you to urinate a lot, and it can also cause the patient to feel dizzy when they stand up. So teach the patient that if they feel like they have to stand up and they feel dizzy, to slowly sit back down and to use their call light if they need help ambulating. Now I'm going to perform hand hygiene. Now I'm going to assess the current IV line that's intact. So I look at it, make sure there's no redness or edema or signs of infiltration. Ask the patient, is it causing them any pain? They say no. Then I have to make sure that the IV line is patent. So to do that, I would lower the IV line, primary IV line. And when I do that, I get good blood return. So that lets me know that it is patent. So then I would hang it back. Then I would perform hand hygiene again. And now I'm going to stir up the hub. I want closer to the patient. And in doing this, I will do it for 30 seconds. So vigorously clean it for 30 seconds. And then I will let it dry for 30 seconds. Now I'm ready to administer my medication. Okay. Okay. Now with discard of my equipment. And to be on the safe side, I will clean it again, just in case. And so after the medication administration, I would observe the patient, make sure they're comfortable, not in pain. And that completes my IV push.